Good morning to Governor Wolf, Dr. Johnson, and all our guests today. It is truly an honor to welcome you to Burke's Community Health Center at Rockland. Burke's Community Health Center is a federally qualified health center founded in 2012. Our mission is to provide high-quality health care to anyone regardless of their ability to pay. In 9 short years, we have grown to 4 locations throughout the city of Reading, serving over 14,000 patients. Thank you to our committed board and directors to make this happen. This location is our largest health center, offering primary care, pediatric care, specialty, and dental care, as well as medication-assisted treatment. Our commitment goes beyond the services I just mentioned. We are committed to reducing barriers for our community members to access health care. We are committed to addressing the increase of chronic disease in our community. And we are committed to being a trusted resource for all community members when it comes to this pandemic, whether it's education, testing, or vaccination. We stand here today in our community room, which quickly became one of our vaccination clinics locations once the vaccinations were available. And you can see all it's set up for that today. I'm proud of how our team has demonstrated again and again just how innovative, hardworking, and professional they are, especially during this pandemic. In a few minutes, our Chief Medical Officer, Dr. Mary Kelleher, will talk about all our efforts on this regard. Now it is my pleasure to introduce the Honorable Tom Wolf, Governor of Pennsylvania.
So thank you, Mary, for that. I'm here for 2 reasons. What I want to talk about is, first of all, say thank you to the hardworking professionals, the healthcare professionals who make clinics like this possible. So I'm here for that. And the second thing is just to really shine light and reaffirm the commitment that Pennsylvania has to the strategy of getting us through COVID-19 with these vaccines. It's working, and we need to keep at it. So again, thank you, Mary, for that introduction, and again, thanks for the Berks Community Health Center for hosting us today. This is a good occasion to say thank you to the folks who have brought us through that. It's hard to believe that it's been over 18 months now that we've gone through this pandemic, but the front lines have been our healthcare workers, and they have done a heck of a lot, and we owe them a lot. Berks Community Health Center is just one of them. They're a federally qualified health center. They're right here in Berks County, and they provide quality care to vulnerable members of the Reading community every day. And we need to get the vaccines out, but we need to make sure that we're doing this, not just getting the vaccines out in clinics, but that we're making sure that we're hitting every segment of the population. And one way that we're doing that is to have vaccine clinics like the ones right here. They're going to have one tonight, 5 o'clock to 8 o'clock, right?
Yeah.
This evening, including now children who are ages 5 to 11. They can now get the vaccine. So again, thank you to the staff here at Berks Community Health Center and to all medical professionals all across Pennsylvania for your hard work. Now the vaccine strategy, it is working, and Pennsylvania is doing a really good job. Let me just give you some statistics from today. We are now 3rd in the nation, number 3. I think Massachusetts and Vermont are the only 2 states that are ahead of us in terms of first doses of vaccines. And as a percentage of the total population, that's 80.2%. Remember, just last week, that the 12 and under were able to get the vaccine. So that ranks us 3rd overall. We're actually 1st in terms of the 10 most populous states. We still have some work to do. Fully vaccinated, we're showing 61.3% of the population. The United States as a whole is 58%, so we're well ahead of that. According to the Department of Health, 18 and older, we're at 95.3%. I don't know where that ranks us in the country for one dose. That's pretty good. But fully vaccinated is 72.8%, almost 73%. You remember when we were originally talking about 70% would be herd immunity. I'm not hearing that so much anymore, but we're there. And we've actually exceeded that. But we have to remain vigilant. The cases in Pennsylvania have been sort of flat. The last couple of days have actually been up. We are at 33 cases per 100,000. So when you look at the places states like Louisiana, Florida, Texas, they were over 100 per 100,000. We peaked, I think, at around 39. And we've been coming down. The last couple of days, we actually had a little bit of a blip. Hospitalizations are down. It continues to be down. And when you look at it by age, we've been flat at the 70 plus. The hospitalizations have been highest with the 70 plus. And we have been flat with the younger generation, those under 39. So, we're doing a good job there, and I think that's something to celebrate. The vaccines really have worked. They've kept us safer. But when enough people get vaccinated, we don't quite know exactly what that level is, but that seems to have worked pretty well for Pennsylvania. We're at the top of the charts in terms of vaccines, and we're one of the best. If you go back, actually, to the very beginning, all the things we've done, we're one of the best in terms of cases per 100,000 in the United States. I think we're 10th best. So the vaccination has increased, has made us even better, and so we need to keep doing that. So let me just make a pitch to everyone out there. Vaccination, that is the best way to protect yourself. It's the best way to protect your neighbors, your friends, your family, and your community from severe disease. I mean, if you're vaccinated, even if you get a breakthrough case, which is not that likely, but if you do, it's very unlikely that you're going to be hospitalized for it. You're probably going to have a fairly mild case. So vaccinations can keep you from getting sick, and they really improve the odds that Pennsylvania is going to make it through this pandemic. Again, we now have the vaccine available for children 5 to 11. That's a very important milestone in our fight against this virus, especially since that means that now all the kids in school are eligible for the vaccine. So, let's make sure that they get those vaccines. Parents and grandparents have enough to worry about when it comes to our kids without a global pandemic going on. But this is something that we can make sure that they do for their children and their grandchildren. Having a safe, effective, and free, you didn't mention that, Central Pennsylvania, free vaccine against COVID to help keep more of our kids safe. That's a real relief for all of us. So I encourage all parents, all grandparents, guardians of children ages 5 to 11, talk to your doctor, talk to your pediatrician, talk to your pharmacist, talk to someone you trust, but get the vaccine for those kids. That's really doing them a favor. We've made a lot of progress in the last 11 months. Again, vaccines are part of that. We want to keep that momentum going. We want to ensure that we have a safe and healthy holiday season, which is coming up, Thanksgiving, holidays, so we get through that. If you still need to get vaccinated, or if you have kids who have recently become eligible for vaccination, talk to your doctor. Again, talk to your pharmacist. Get the vaccine. Safety and peace of mind is the best gift you can give yourself and your family this holiday season. So remember, vaccinations are safe. They're easy, and they're free. They are free. Our community vaccine providers are doing very hard work every day to get shots in their arms, just like here this evening. Come in and get your vaccine. We need to keep this momentum up, the vaccination momentum, to get past this pandemic, and we get every Pennsylvanian we can to get the vaccine right now. So thank you, and now I am proud to turn this over to Pennsylvania's Physician General, Dr. Denise Johnson. Dr. Johnson.
Thank you, Governor. Well, good morning, everyone. Thank you, Governor Wolf, and thank you, Berks Community Health Center. I'm so glad to be here with all of you and really celebrating expanding vaccination. Now that we have vaccinations available for the 5-year to 11-year-olds, we're all excited for this new development. We need to continue to educate people who have not been vaccinated or who have only gotten a 1 shot of a 2-dose vaccine that vaccination is our best way out of this pandemic. We also want to make sure that people understand that the pediatric vaccine is not going to only protect the children, but it's also going to protect those around them, and it's going to protect them so that they could safely play, learn, be a kid, and also to be in school safely and continue that in-person learning, which we all want to make sure that they have. And it also protects them against the COVID-related illnesses and hospitalizations and ultimately death. It's the best way to protect our children. We know, as you heard, these vaccines are safe, they're free and fully available and available here and at many locations across the Commonwealth. So in health centers like this, as well as pediatric offices, pharmacies, other locations, primary care offices as well. We know that sometimes vaccinations can be scary for children, and so we recommend that parents prepare their child, make sure that the child knows what to expect, that they may feel a sharp pinch or a poke. Also helping to distract them while they're getting the vaccination can be helpful by calling their name or singing a song, tell them a story, just to make it a lot more comfortable for them. In addition to the pediatric vaccines, we also have eligibility for booster doses. So those people who are eligible, people over 65, people who live in nursing homes or their health condition puts them at risk, or people who live or work in situations that put them at high risk are eligible for boosters. And at this clinic, like many others, you could get that booster dose as well. So you can bring your family in to get the pediatric vaccines, but also to get primary series vaccines for your family, as well as the booster doses for any of those who need those doses. As Governor Wolf said, we're coming on to the holiday season. This is a time when we're moving indoors. We know that the virus is more easily transmissible indoors. And so as we have more indoor functions, indoor gatherings, you're getting together with your family for the holidays, you want to make sure that you give them the best protection that they can get. So make sure that everyone who's eligible, that means children 5 years and older and all of the adults should be vaccinated. And encourage your family to be vaccinated before the season, but all of those of you who have already been vaccinated, this is a time to make sure that all of your friends and loved ones know that this is our best protection, our best way out of this pandemic. Again, these vaccines are free, they're fully available. We're committed to making sure that vaccines are accessible throughout the state. We're also making sure that people have the information that they need to be able to make that decision to be vaccinated. So all of you who've already been vaccinated and gotten your children vaccinated, we thank you for stepping up and helping get us past this pandemic. And we need to continue to take those steps to make sure that every possible person is vaccinated. Now, I'd like to turn it over to Berks Community Health Center's Chief Medical Officer, Dr. Mary Kelleher.
Good morning to Dr. Wolf, Dr. Johnson, and everybody else visiting us today. We want to welcome you to Berks Community Health Center and thank you for coming. I can reflect now that at the beginning of the pandemic, many of us in primary care watched as our colleagues in the long-term care facilities, the hospitals, and emergency rooms were overwhelmed as they struggled to take care of the increasing patients sick with COVID. In December of 2020, when the first COVID vaccine was approved on emergency use authorization, federally funded community health centers throughout the Commonwealth, including Berks Community Health Center, knew that it was our turn to take a role in ending the pandemic. We now had a staff that was ready and willing to start the vaccination efforts in our community, and we understood that providing vaccine access was critical in keeping our communities and our patients safe. Since our vaccination effort began, we have vaccinated 16,954 individual patients. We had 162 different days where access to vaccine was available. We have tried always to respond to the needs in our community. So when in the beginning of vaccines, the EMTs, first responders, and healthcare providers who are not associated with major health systems struggled to get access to vaccine, we provided that access. We knew that there were inequities in healthcare, and sometimes those inequities get exaggerated during public health pandemics and emergencies, so we were determined to make sure that those inequities did not apply to vaccine access. When we knew that the homeless population was not likely to show up at our vaccine sites, we went to them. When we knew there was distrust among underrepresented minority groups, we partnered with the Latino Connection and served on panels with the NAACP in our county to try to overcome vaccine hesitancy. When we knew that the agriculture workers who had never stopped working weren't really able to telecommute when you're an agriculture worker, we went to their sites. We went to Giorgio mushroom farms and went on their grounds to vaccinate their workers. We sent teams to do home visits with the homebound. We went to the jails. We went to homeless shelters. We partnered with the dialysis centers who had some of the most medically vulnerable patients. We went to drug treatment facilities, to schools. We basically worked with whoever was wanting and willing to work with us. We knew eventually that the demand for vaccine might outgrow our ability to provide it, so we were very proud and honored to work with the County Commissioner's Office to open a vaccine center that was centrally located for all of Berks County to access vaccines. We now stand ready to make sure that the youngest in our community can be safely vaccinated. We believe that providing access to children is the next important step in keeping our communities healthy and our children in school. Finally, I want to thank the Governor's Office and the PA Department of Health for entrusting us with making sure that the most vulnerable within our state had access to this life-saving vaccine. We thank you for that trust, and we will continue to strive to make sure that equitable access to the COVID life-saving vaccine is a priority in our community. Thank you.
Thank you, Dr. Kelleher. And I thank you all for coming today to welcome Governor Wolf and Dr. Johnson to BCHC. You've heard today how committed we are in fighting this pandemic and being a valuable resource for our community members. We want you to know that we are here for you. If you're not vaccinated, I urge you to come to our Rockland location this evening from 5 to 8 p.m. and tomorrow from 9 a.m. to 3 p.m. to get your vaccine. Or for future vaccine and testing clinics, visit our website, www.berkschc.net, for a schedule throughout the end of the year. I'll leave you with this. Please get vaccinated. Protect yourself and your loved ones from this terrible virus. Now it is my honor to invite Governor Wolf back to the podium to open up for media questions. Thank you.
So thanks, Mary. Thanks, Mary, and thanks, Dr. Johnson. I appreciate everything that you're doing, and now I'm happy to take questions.
Governor, in the days since your office announced that beginning in January, schools can choose whether to keep or get rid of masks. In the days since you announced that, what kind of pushback has your office received, if any, and what would your message be to any critics who would maybe prefer you to just get rid of the mandate now?
Yeah, I haven't really had a whole lot of pushback. I mean, I think some people are wondering what's with the January 17th date, January 18th date. The idea is that we put the mask mandate in because when schools started, the kids 5 to 11 were not able to get the vaccine, and that's our strategy. And when all of a sudden that became available last week to ages 5 to 11, that became a big deal. Now we had to think about, okay, so now you get the vaccine. There's 3 to 4 weeks between the first and the second dose. It maybe takes some time before you get your first appointment. And then it's 2 weeks after you get your second dose that you're really immune. So we're talking weeks here, some time. What would be the right time? Was it January 17th? Was it February 1st? Was it December 31st? We picked January 17th, and I think that was the right date to make sure that this strategy, the vaccine strategy, has time to take hold in the new group that now has the ability to get the vaccine.
Do you reserve the right to push that date back? Do you have any plans to push that date back?
I don't have any plans to push that date back, but I guess, yeah, I mean, if the meteor hits the Commonwealth or something happens that none of us foresees, But we all of us, the Department of Health, my office, me, every morning wake up and look at case counts, we look at hospitalization rates, we look at all those things. And I think this gives, along with the vaccination strategy, all these things gives us the reason to believe that you know, we're going to be moving into this disease is going to be with us. It's going to be endemic. We're going to have to change the way we live and all that kind of stuff, but we have to figure out how to get away from the mandates and into making sure that now the people have the ability to protect themselves, that they take advantage of it and they make that decision.
How do you reach people in parents particularly and their kids in these areas that have very low vaccination rates at this point? Because the vaccine's been available for a very long time, but I was talking to a superintendent very recently who said our parents, we estimate it's about 35%. They don't expect the students to even, get higher than that.
Yeah, again, that's why I look at Pennsylvania statistics overall are really good. Are there pockets that where we can do some work? Yeah, and I think where we've seen those pockets in terms of professions, in terms of vulnerable groups, in terms of groups who don't have the mobility to get to a place where they can get the vaccine, a pharmacy or a clinic. We need to make special efforts, and that's I think what Mary was talking about. That's what Berks is doing here. That's what federally qualified health centers all across the Commonwealth are doing, and we're making special efforts like this press conference to get the message out. So yeah, I think there will be pockets, but overall Pennsylvania's done quite well. Again, we didn't get to be third in the nation in terms of first doses. I think we're number one actually. Just look at the 65 and older in terms of first doses. So you don't get to do that if we haven't been doing a good job. So we're trying to do as good a job as we can to make sure everybody understands this is something that really does make sense, makes a difference. It's safe, it's free, it's available, and it seems to be working.
I know yesterday that the House Transportation Committee advanced the bill to kind of put the kibosh on the bridge tolling plan that PennDOT has put out. I just wanted to ask, the chair of that committee said, why don't we use some of this new federal money that we have available? Can you talk to?
Yeah, that's a good idea. I think we just found out yesterday Pennsylvania is going to get $13 billion for bridges and roads. That's one-time money. So we're going to have to figure out how we pay for infrastructure moving forward. So I think the chair is right that we ought to, and absolutely ought to take advantage of the source of funding that we now have that we didn't have before. But when that runs out, what do we do? We're going to come back to the same issue. How do we fund this? The problem is that what we've done in the past is fund public infrastructure, roads and bridges with a gasoline or diesel tax. Well, cars are getting more fuel efficient. A lot of cars don't use fossil fuels at all, electric vehicles, and more vehicles are doing that. And so the income at the federal level and the state level from gasoline and fossil fuel taxes are diminishing. So what do? So yeah, right now we have the infrastructure bill, and that's provided some relief, but it is a one-time relief, and we're going to have to come back to this. So one way or the other, we're going to have to figure this out.
During your remarks earlier, you mentioned the upcoming holiday season. Obviously, last year the holiday season was there was a spike in cases
Yes.
and hospitalization and death. Your plan to remove the school mask mandate is set for just after that holiday season this year. Are there any concerns about the timing of that? If there is another spike over the holiday season to then follow that by getting rid of masks in schools?
No, I'm not sure what the connection is. Schools are going to be out during the holiday season anyway, and the mask mandate was really just for the schools and in-school activity. I think the date was really an effort to make sure people had time to get the vaccines. That's our strategy, and it's working.
Governor, a lot of our viewers have been wondering about your mail-in ballot. Do you know if it was invalidated? Have you heard anything from the York County DA's office about it? Or,
Are you talking about my ballot?
Yeah, the mail-in ballot.
I hadn't heard that it is.
And have you heard from anybody from York County about whether there's going to be anything, any kind of follow-up regarding that?
No, I haven't. I made a mistake. I goofed. Let me just say that I have made mistakes in the past, and I'm pretty sure I'm going to be making them in the future. So that was just one in the series. Anything else? All right. Thank you very much. Thank you very much.
We're trying to really stop.